أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Today we are going to discuss a topic called as leptospirosis, which is a zoonotic disease. It is caused by a bacteria which is called as Leptospira. Antibodies against many Leptospira serotypes. They are commonly found in up to 90% of the horses, even with no history of reported clinical signs of illness. This topic which is being discussed, leptospirosis, we are specifically discussing it with reference to the horses. Clinical signs in acute phase, there is a high fever 106 degree Fahrenheit or 41.1 degrees Celsius, and anorexia is also found in this condition. Mild depression and abortion is also possible in pregnant females. Icterus present if there is a significant hemolytic anemia. Significant hemolytic anemia. Hemolytic anemia means a condition in which red blood cells, they are destroyed faster than they are made. So if hemolytic anemia is present, then icterus condition may be seen. Recurrent uveitis is also a clinical sign which is noticed, and this may appear months later. Uveitis is actually inflammatory condition inside the eye, and it happens when immune system is fighting with the infection. Diagnosis, when if we are going to diagnose this disease, we should send the samples, blood samples into the lab, and this may be a retrospective diagnosis, means diagnosis after the death of the patient, may also be done, and aids to diagnosis. They are bacteriology, hematology, serology. If we talk about the bacteriology, in bacteriology we can perform culture of the organisms from the blood in acute phase only, and in hematology, leukocytosis means high WBCs, white blood cells count in the blood that can be noticed, and neutrophilia can also be noticed in hematology in leptospirosis. Neutrophilia means high neutrophil count in the blood, and hemolytic anemia is also noticed. Serology can also be performed in acute and convalescent phase. Samples should be taken if possible, and indications of previous disease frequently found on routine serology, as the leptospira antigens may persist in high levels for up to 2 years. Treatment. So far as the treatment is concerned, two drugs are a drug of choice in leptospirosis. Number one, penicillin, and number two, dihydropenicillin. So these two drugs, they are the drugs of choice. Prognosis is very good, and recovery occurs fully if we treat the animal properly in time. This is a zoonotic disease. So note it please. This is a zoonotic disease. Means disease spread from animals to humans. So proper precautionary measures should be taken to avoid direct contact or aerosol contact with the infective discharges. So avoid the contact with the urine, specifically in hurricane season, in heavy rain seasons, and in flood seasons. This was a little bit about the leptospirosis. We will come with the next topic, inshallah, very soon.